regarding the operation theatre. So what is OT, the importance of OT, the structure of an ideal OT, the plan for preparing an OT, and also the functions of OT we will be discussing. Okay. So before going into the OT or operation theatre, we will see some of the basic terms as well as concepts. Okay. So these are the types of, you are able to see the screen, right? The slides?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So these are the types of surgery. So first one is called as elective surgery. Second one is called as urgent surgery. The third one is called as emergent surgery. And fourth is called as required surgery. Okay, so these are the types of surgeries. Elective surgery, urgent surgery, emergent, required surgery. Okay, this we will come later. So first let us see what is elective surgery. Okay, so this is performed on the basis of client's choice, okay, which is not essential and may not necessary for health. Okay, so it is performed on the basis of client's choice. Okay, which means that the surgery can be scheduled in advance. Okay, like if you have a kidney stones, or if you wanted, if the mother is a pregnant, okay, and they wanted to decide which date the delivery has to take place. Okay, that such types of surgeries you call it as elective surgeries, that the patient will be planning the date of surgery. Okay, so examples of these types of surgery is kidney stone removal, as well as removal of wart. Wart in the sense small growths that you will be able to find in the skin. Okay, usually in the neck, in the chest part, as well as in the face. Okay, so that surgeries can be coming under this elective surgeries. Then LSCS. LSCS is lower segmental cesarean section. Usually it is being done as a surgical procedure to remove the baby from the mother. Okay, so clear what is elective surgery? So it is performed on the basis of client's choice. Okay, so the patient can decide the date when the surgery has to be taken place. Okay, so it is not much it is not an emergency type of surgery. Okay, next is urgent. So necessary for client's health, may prevent additional problem from developing, not necessarily emergency. Urgent in the sense it is not coming under the emergency type, but it is necessary for maintaining the client's health. Okay, and also to prevent additional problems, you are doing this urgent surgery. Okay, so the patient can wait, or the doctors, they will be waiting until the patient is medically stable. Okay, and you can do it within 2 days or 3 days. Okay, so for example of urgent surgery is if the patient wanted to undergo appendicitis. Okay, that is appendicectomy. You know what is appendicectomy, right? Removal of the
appendix.
And appendicectomy is removal of the appendix. Okay, so when a patient is having an appendicectomy surgery, which is being planned today or tomorrow, and if you are checking the blood sugar level of the patient, okay, in the morning when you are checking the blood sugar level, if it is high, okay, so you will be planning the surgery after 2 days. Okay, you will be having the patient compulsory, the patient is having the surgery, but because the patient is having some other additional problems, to maintain or to make the patient's body stabilize, you are waiting for that day to come. Okay, that is called as urgent surgeries. Okay, so you can wait until the patient is medically stable. Okay, so if the patient is having diabetes mellitus, and also if you wanted to go for a surgery like appendicectomy, you should first make the glucose level to come to normal. Okay, so for that they will be giving insulin. Okay, so doctors will be providing insulin for the client, that is in normal saline they will be mixing, and as continuous infusion they will be giving. Okay, so once the patient is medically stable for the surgery, they will be conducting the surgery. Okay, that is called as urgent surgery. Clear with what is urgent surgery?
Yes, ma'am.
And the third one is called Okay. Third one is called as emergent surgery. So this must be done immediately to save the life or preserve the function of the body part. So you know what is emergency surgery, right? So it is like a life-threatening event if it is happening for the client. Immediately you have to do the surgery. Okay. It is to save the life of the client or to preserve the function of a body part. Okay. So emergency surgery has to be performed without delay. Do not show any delay. Immediately you have to do the surgery. That is called as emergency surgery. The patient will not have any other choice, okay, other than immediate surgery. Okay. So or else if you are not performing the immediate surgery, it can lead to any permanent disability or death. So to avoid the disabilities as well as death, you are doing the emergency surgeries. Okay. Can you give any examples for emergency surgeries?
When the patient feels a chronic, acute, sudden and acute onset of appendicitis pain, the patient will feel intolerable, then the doctor go for
emergency. Yeah. Okay. That is when it is in late stages of appendicitis. Okay. Like the patient will be having this pain will increase when there is a rupture. Okay. When there is a high or in the latent stages of appendicitis, you will be able to identify there will be a rupture. Okay, which can be an emergency. So you have to go for an emergency surgery. Okay. Any other types of emergency surgeries? Any other examples for emergency surgeries?
like
In case of labor pain, in case of
Labor,
yeah,
very good.
if there is complication,
Not,
then
only when there is complication. Okay, labor
in
pain,
case of
which is a normal one, but
if there is some
other
complications,
very good. That can also be an emergency surgery. Okay, so these can be the examples for emergency surgery where you are performing the surgery to save the life of the client. Okay, so that is called as emergency surgery. Next, the required surgery. So it has to be performed at some point and can be pre-scheduled. It is somewhat same like this elective surgery. Okay, so required surgery in the sense it is done to retain the quality of life of the client. Okay, so it is not necessary that you have to perform these type of surgeries immediately. Okay, so you have to retain the quality of life of the clients. That is why the doctors go for the required surgery. For example, cataract. Okay, you know what is cataract, right?
eye operation.
Yeah, eye operation. Okay, when there is a layer that is being formed. So usually you will be getting this cataract in the old age. You will be able to see in the old age people. Okay, so it is done to improve the quality of life. Okay, so once you do the cataract, patient will be able to regain his vision. Okay, so to regain his body function, you are doing this required surgery. Okay, so it can be performed anytime. Okay, so has to be performed at some point. Okay, any time in the life that has to be taken place, and it can be pre-scheduled. Okay, you can pre-schedule the date that the surgery has to be taken place. Okay, so clear with these 4 types of surgeries. And also some example for this required surgery can be sinus operations. So those who are having sinusitis, severe sinus. You know what is sinusitis, right? Inflammation of
Sinuses.
sinuses. Okay.
Yes, ma'am.
Sinuses in the sense you have the air chambers in your face, right? In the facial part. Okay, so those chambers will be filled. Those are air chambers. Okay, so when it is filled with mucus, okay, or sputum productions, then it becomes an infection. Okay, so they will be going for a sinus operations for removing or cleaning the sinuses. Okay, so that can also become it can also be considered as a required surgery. So elective, urgent, emergent, as well as required. Clear with these 4 types of surgeries?
yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So next, types of surgeries: diagnostic, corrective, reconstructive surgeries. Diagnostic, corrective, as well as reconstructive surgery. So diagnostic surgery, in the sense, it allows to confirm the diagnosis. Okay, so it allows to confirm the diagnosis. So it is a method of obtaining a tissue sample. Okay, so that it will be helping doctors to confirm a disease condition. Okay, so you are to confirm a disease condition, you are doing this diagnostic type of surgery. Can you give any examples for diagnostic surgeries? No?
Laparoscopy.
Laparoscopy, very good. Laparoscopy.
It is the endoscopy, various type of endoscopy, laparoscopy, gastroscopy,
Biopsy. Okay.
biopsy, colonoscopy, several types.
All these can be considered as the diagnostic surgeries. Okay, so to confirm a diagnosis or to confirm the disease condition that is being present in a patient, you are doing such types of surgery. Best example is biopsies. Okay, if the patient is having any growth, okay, or any cancerous growth, to identify whether it is a benign or a malignant type of cancer, they will be doing this diagnostic procedure. Clear with what is diagnostic type of surgery? Next is, yes?
Yes, ma'am.
Yes, ma'am.
Next is corrective surgery. Okay, so corrective in the sense excision or removal of a diseased body part. Okay, that is called as corrective surgery. So you will be excising or removing a diseased body part. Example is appendicectomy. Okay, so if it is completely infected, you will be removing that particular part. Okay, or if the patient is having a cancer of the stomach, either partially or completely, they will be removing the stomach. It is like a corrective surgery. Okay, so excision or removal of a diseased body part is called as corrective surgery. And next one is called as reconstructive surgery. Reconstructive. Okay, so it is to restore the function or appearance of traumatized or malfunctioning tissue. Okay, so if there is any injured tissues or else any malfunctioning organs, so you will be able to restore the function of that particular organ or else the tissue. That is called as reconstructive surgery. Can you give any examples for reconstructive surgeries?
Like in the case of liver hepatoectomy, generally damaged cells are removed to save the normal functioning of the other cells can be promoted by. So,
Okay. Any other?
or in the GIT,
Cleft palate, ma'am.
Okay. In the GI, like
bypass
best
grafting is
example.
one of the.
Yeah, bypass graft. Okay, best example is like congenital defects. Okay, like if the child is having, usually this reconstructive can be, mostly it has been done for these children. Okay, pediatric cases. If the child is having a cleft palate, do you know what is cleft palate?
Yes, ma'am.
Congenital defect. Okay, so for that they can go for this reconstructive surgery. Okay, they are rectifying or correcting a particular body part. Okay, it is mainly to restore the function of that particular body part. Okay, so clear with what is diagnostic, corrective and reconstructive, right? So next is procurement for transplant, constructive as well as cosmetic surgery. Procurement. Do you know what is procurement? Procurement is like an agreement. Okay, so that is called as procurement for transplant. You are giving an agreement for transplantation. That is called as procurement for transplant surgery. So removal of organs or tissues from a person pronounced brain death. Okay, so you know brain death persons in the sense only he will be having a breathing. That's all. None of the other systems will be functioning properly. Okay, completely it is dead, like a vegetative organ. The person will be okay. Everything other persons has to help him or her to do the daily activity. Daily activities is not taking place. So completely the patient will be in coma. Okay. So procurement for transplant in the sense removal of the organs or tissues from a person who is being considered brain death. Okay, or who is being diagnosed as brain death for transplantation into another person. Okay, so this is called as procurement for transplant surgery. So when a patient is coming with brain death, they will be taking the organs for transplantation. So for this, usually either the person who is brain dead will have an agreement that is being signed priorly itself. Okay, so you even now you can give a that is organ donation signature. Okay, in a hospital you can go and you can there will be a form for organ donation. You can if you are signing it, it means that you are willing to donate your organs after your death. Okay, so if the person has already agreed, you can go for the organ donation in such brain death patients. Okay, or else if the family members are willing to give the organ donation of that particular person, then they have to sign the agreement. Okay, so they will be showing their willingness for organ donation. If such things, if they have agreed, you can go for the organ donation. Okay, that is called as procurement for transplant surgery, which means that you are agreeing for a transplantation, which can be given. That is, your organs can be given to some other person for transplantation after death or else after this brain death. Okay, so clear what is procurement for transplant?
Yes.
Yes, ma'am.
Next is constructive surgery. So constructive surgery is somewhat same like the reconstructive surgery. Okay, so it restores the function lost or reduced as a result of congenital anomalies. Okay, you are restoring the function. Example is the person has any congenital anomalies. You are doing a surgery to maintain the function of that particular part. That is constructive surgery. And last one is cosmetic surgery. So cosmetic surgery, any idea about what is cosmetic surgery?
Plastic
Yes, ma'am.
surgery.
Plastic
surgery, facial surgery, lip surgery, like physical appearance modification
Enhance
surgery.
the physical appearance.
Yeah, beauty, to enhance their beauty, they'll be doing this cosmetic surgeries. Usually you can see these type of surgeries. It has been performed by actors and actresses. Okay, those who are in film industries. Okay, yeah, so they'll be doing this cosmetic surgery. Okay, it is performed to improve the personal appearance of the client. Okay, so facially they'll be doing plastic surgeries, and also if they are obese, they go for liposuctions. Okay, so liposuction in the sense excessive fat will be removed. Okay, so that they appear slim. So these are some of the cosmetic surgeries that you will be able to identify. Okay, so clear with what is procurement for transplant, constructive as well as cosmetic surgery.
Yes, ma'am.
So these are the types of surgery. Okay, so elective surgery, urgent surgery, emergent, required, diagnostic surgery, corrective surgeries, reconstructive surgery, procurement for transplant, constructive surgeries as well as cosmetic surgeries. Okay. So next we'll see the types of surgery according to the extent as well as the location. Okay. So according to the extent of surgery, it is divided into simple as well as radical. Okay. So according to the extent of surgery, it is been divided as simple surgery as well as radical surgery. So simple in the sense only the most overtly affected areas involved in the surgery. Okay, only the part that is being affected is removed. Okay, that is called as simple surgery. And radical in the sense it is an extensive surgery. Okay, so beyond that they will be removing. Okay, that is called as extensive surgery. Beyond the area obviously involved is removed. Okay, it is directed at finding a root cause. Okay, for this radical surgery can be done in cancer patients. Okay, so if they have a cancer of the stomach and if it has affected the esophagus or else if it has affected the duodenum, so along with that they will be along with the removing the stomach, they will be removing half portion of the esophagus as well as the duodenum. Okay, so that is called as radical surgery. Whichever part there is a metastasis, they will be removing. Okay, so clear what is simple? Simple in the sense only the affected area will be removed. Example is appendicectomy. Okay, so only that part will be removed. Then radical in the sense the affected part as well as if there is any spread to the nearby organs or structures, even that also will be removed. Okay, that is called as radical surgery. So this is according to the extent of surgery. It has been divided as simple as well as radical. And according to the location, so based on the area of the body on which the surgery occurs. Okay, so if it is in the abdominal part, it is abdominal surgery. If it is in the heart, it is called as a heart surgery. Okay, so according to the location of the affected areas, the surgery will be taking place. Okay, so it is based on the area of the body on which the surgery occurs. Okay, example is abdominal or heart surgeries. Okay. So then next is the purpose of surgeries. Okay, so purposes will be same like the types. Okay, so first purpose is for the diagnostic. You are able to hear me, right? You are listening?
Yes, ma'am.
Okay, so first purpose is diagnostic purpose. Okay, so to confirm the diagnosis or determine or confirm the diagnosis, the patient, that doctors will be doing the surgery. Okay, so for example, breast biopsy, bronchoscopy. Okay, we have seen already. Second purpose of the surgery is for cure or curative. Okay, so for curing or for treating a disease, you are performing the surgery. Okay, so this is a removal of a diseased tissue, organ or extremities. Example, appendectomy, amputation. If the patient is having any diabetes, like wound, if they are having, they go for an amputation if it is not been cured properly. Okay, if you find gangrene or else if you find any else which can affect the other areas of the body, so that they go for an amputation. Amputation is removal of the affected body part. Okay, so that is cure or curative purpose. Okay, so just you are removing a diseased tissue, organ or the extremities. Okay. The third purpose is for constructive. Okay, so you can build the tissues or organs that are absent or congenital anomalies. Okay. Example is cleft lip repair or cleft palate repairs. Okay, so to bring back the function of the organs or else the tissues to normal, you go for this constructive surgeries. Okay, so this is the third purpose. And next is prevention or preventive surgeries or so prevention or preventive surgeries in the sense you are removing a mole or else a wart, even for cancers. Okay, if there is any cancerous growth, as a preventive measure you are just removing it off. Okay, so that, and also if the patient is having any kidney stones, okay, so you are removing it. Okay, it is like a preventive or a prevention surgery. Next is reconstructive. So because we have already seen in the types, I am not explaining much. Okay, reconstructive, you rebuild the tissue or organ that has been damaged. Okay, like skin graft after a burn, total joint replacement can be a reconstructive surgery. Okay. Then exploration. So surgical examination to determine the nature or extent of the disease. Okay, so if the person is having an ulcer, you can go for this exploratory. You are investigating whether the disease, how it has affected the organ or not, that you are exploring or investigating. Okay, that is called as exploration purpose. So surgical examination to determine the nature or extent of the disease. Okay, so laparotomy can be done for ulcers, and also if there is any cancerous growth, you can go for this explorative type of surgeries. And the last is cosmetic improvement. So that is also a purpose for this surgery. Repairing a burn scar, changing the breast shape. Okay, all these can be the cosmetic improvement. Next, purposes of surgery is for palliative. So palliative in the sense to alleviate the symptoms of a disease. Okay, so usually palliative it is when the patient is terminally ill, you will be giving this, or you will be going for this palliative type of surgeries. Okay, in case of cancers, you will be able to find the palliative care. Okay, so to alleviate the symptoms or to reduce the symptoms, you are doing the surgery. Okay, so that the disease you will not be able to cure, but the symptoms can be cured. Okay, so that is called as palliative surgeries. So example, bowel resection in client with terminal cancer. Okay, when the client is in the last stage of cancer, that is in the 4th stage, and he is about to die, if the patient is willing to decrease the symptoms like nausea, vomiting, pain, all those things, can go for the surgery. Okay, like bowel resection. That is called as palliative surgery. Palliative is nothing but you will be only curing or you will be subsiding the signs and symptoms. Okay, you cannot cure the disease. Okay, that is what is called as palliative treatment or palliative surgery. And then the the next purpose is for transplantation. So replace the organ or tissue to restore the function. Example, heart lung transplantation, liver kidney transplantation. Okay. So these are about the purposes of surgery. Okay. So all the types we have seen you can include in the purpose. Okay. So important suffixes that is related to the surgery. So suffixes in the sense any word that the end, the second half of the word is called as the suffix. Okay. So first one is ectomy. So ectomy in the sense it is, you already know, it is excision or removal of any part. It is called, it is called as ectomy. Example is appendectomy, which means that it is removal of appendix. Okay. Then lysis. Lysis is destruction or it is breakdown. Okay, that is called as lysis. Example is electrolysis. Okay. Then oraphy. Oraphy in the sense it is repair or suture off. Okay. So oraphy in the sense it is repair. Okay. So herniorrhaphy. Okay. So after removing the hernias, you will be repairing it. Okay. You will be suturing it. Then oscopy. Scopy in the sense it is looking into or you view. Okay. So visualizing is called as scopy. Okay. So example is endoscopy, visualization of the esophagus or else the stomach. Then ostomy. Ostomy is creating or opening it. Okay. Example is colostomy. Ostomy, so opening the colon. Okay. Then otomy. Otomy in the sense it is cutting into or incision of. Okay. Example is tracheostomy. Then colonostomy. Okay. So gastrostomy, gastrotomy. Okay, all these comes under this otomies. Okay, otomy in the sense cutting into or incision of. Okay, tracheostomy. Okay, or tracheotomy. Then plasty. Plasty means repair or reconstruction of. Okay, example is mammoplasty. You are reconstructing the breast. That is called as mammoplasty. Okay, this will be done after if there is any cancerous growth. You will be doing for this mammoplasty. You are going to repair or reconstruct the breast. Okay, so these are the suffixes that is related to surgery. Okay, so first one is ectomy, which means it is removal or excision. Lysis, destruction, okay, or breakdown. Then raphy in the sense repair, or you can suture it. Okay, somehow it is repairing. Then scopy, that is visualizing or looking into. Ostomy is opening. Okay, creating an opening. Then otomy is incision into or cutting into or incision of a particular organ or a body part. Plasty is repair or reconstruction. Okay, so clear with these suffixes? So anything that is coming in front, you have to just apply it. Okay. So this will be, you will be able to learn or you will be seeing in the wards. Okay, when you are checking the files of the client, you can find all these suffixes along with the medical term or else a body part. Okay. So the next is surgical setting. So this I think we will see in the evening class. Okay, so 2 to 4 I will be continuing. Okay, continuously 2 to 4. Okay, 2 to 3 and 3 to 4 I will be taking the class. Okay. You don't have any other class, right? 3 to 4. Are you able to hear me? No. Okay.
No, ma'am. No class 3 to 4.
So continuously 2 hours I will be continuing. Okay.